Well, thank you. It helps to call attention to what's happening.
Good afternoon and welcome. Thank you so much for joining us. My name is Natasha Murphy. I am the Health Policy Director at the Center for American Progress Action Fund, and I want to thank you for joining us for the true cost of the Republican healthcare agenda. But before we get started, a few housekeeping items. First, today's session is being recorded, and a recording will be available on the CAP Action website upon the conclusion of this event. In addition, to ensure that today's event is accessible, closed captioning is available. You can activate this feature by clicking on the bottom of the Zoom screen where you see the closed captioning button. And finally, please use the Q&A button to submit your questions. We will try and get to as many of them as possible this afternoon. As many of you know, we are at a critical point. Republicans control the White House, the House, and the Senate, and they're steering us towards a government shutdown, with healthcare at the center of that fight. An estimated 20 million people will see their healthcare costs and premiums almost double in 2026. Families will face increased out-of-pocket expenses, and millions are at risk of losing coverage. This is the direct result of Republican policy choices, including rejecting efforts to extend the Affordable Care Act's enhanced premium tax credits, finalizing harmful regulations that will shrink marketplace enrollment, as well as raise deductibles, and of course, passing the big beautiful bill that slashes Medicaid, Medicare, and the ACA marketplaces. Democrats have been clear. They will not sacrifice Americans' health care. Protecting affordable coverage is non-negotiable. And with so much at stake, it's vital to hear from leaders who have consistently fought to defend healthcare and to protect families from these harmful choices. And so it is my absolute pleasure to introduce a public servant who has championed accessible, affordable healthcare, not just for her home state of Georgia, but for all Americans. Senator Shaheen was the first woman in U.S. history elected both governor and United States senator. Since joining the Senate in 2009, she has built a reputation for working across the aisle to deliver results, championing legislation including the Affordable Care Act and the CHIPS and Science Act. She currently serves as chair of the Senate Committee on Small Business and Entrepreneurship and holds senior roles on the Services, Foreign Relations, and Appropriations Committees. Please join me in welcoming Senator Shaheen.
Thanks very much, Natasha, and to the Center for American Progress and everyone who's watching this vital conversation about how we ensure that Americans continue to have access to health care at a cost they can afford. You know, it's particularly ironic because last year in 2024, we saw a record number of people enrolled in the ACA marketplace. We saw that in New Hampshire, my home state, as well. And to think that because of the president's, what he calls the big, beautiful bill, what I call the big, beautiful betrayal of the American people, we're going to see millions of people who are going to lose their access to health care. The piece of that I wanted to focus on for this conversation is the enhanced premium tax credits that Natasha mentioned. It's something that I've worked on since 2019, worked with getting those in the American Rescue Plan, getting them extended in the Inflation Reduction Act, to ensure that those people who can't afford health insurance are able, with those tax credits, to be able to afford the cost of that health insurance. We know that because of what the Republicans have done in failing to extend the premium tax credits, allowing them to expire at the end of December, that we're going to see over 20 million people who are going to see their costs increase for health insurance by an average of about 75%. So that's huge. For families in New Hampshire, we're talking about in one of our northernmost counties where the average family income for a family of four is about $75,000, they're going to see premium increases of over $3,300. That's a lot of money that many people are not going to be able to afford. And we also know that there's an impact on small businesses because of what will happen with if we don't extend the premium tax credits. I worked with some of my colleagues to get Georgetown University Center on Health Insurance Reforms to do a study of what the impact would be if those tax credits expire and people aren't able to benefit. And what they came back and told us, it confirmed what we were most concerned about. And that is the people who will be most affected are small business owners and their employees, people living in rural areas, working families, and older Americans, the people who can least afford to pay those cost increases. And in addition to the 20 plus million people who are going to see their costs go up, we know that about 4 million people are going to actually lose their access to health insurance because they just won't be able to afford it. I did a roundtable last week in New Hampshire with a number of small business owners. We had somebody who owned a restaurant. We had someone who had a marketing firm, a nonprofit, several other small businesses, all of whom had fewer than 20 or fewer employees. And what they all said is without those premium tax credits, they would not be able to cover their employees for health insurance. And they were worried about what that meant in terms of retaining those employees and actually ensuring that they could continue to be healthy and work in their operations. So we know that there are real implications for not extending those tax credits. And we just had a study from the nonpartisan Congressional Budget Office that came out and said, we really can't wait until the end of the year. That's one of the things that we're hearing from some of the Republicans in Congress that, well, we should wait. We don't have to worry about it until December. But what we heard from the Congressional Budget Office was if we wait, we're going to see 1.5 million people lose their health insurance if we wait until later in the year. So that's not an option. This is a problem that is not that difficult to solve. We ought to be able to agree that it's in everyone's interest to ensure that people can have access to health insurance at a price they can afford. We've seen Donald Trump's own pollsters say that if we don't solve this, that it's going to be bad for the GOP at the next election. So it's in their interest to do this. And we know from polling that the American people want to see this done in a bipartisan way. So I hope that as the leadership in the House and Senate are negotiating with the White House, that they'll recognize this is one of the things that everyone can benefit from. And people can't feel secure about their lives if they're worried about what happens if they or their families get sick and can't afford to go to a doctor. So it's critical for all of us to ensure that we get this done. That's what I'm continuing to work for. I hope that we can all work together and really appreciate CAP's engagement, because the more we can let people know about this, the more likely they can contact their elected officials and we can get this done. So thank you again, everybody. I look forward to working with you, and I look forward to continuing this fight for the American people.
Thank you so much, Senator Shaheen, for those remarks. Like you said, the time really is now, and Americans cannot afford to wait for legislative solutions to keep our healthcare and coverage affordable. We appreciate your continued leadership and advocacy on this issue in defending affordable healthcare for this country. Now I am going to turn our panel discussion over to additional experts. So I am happy to welcome to the virtual stage Andrea Harris, who is the Director of Policy Programs at Protect Our Care, as well as Krissa Onstenso. She is a Wisconsin resident, a former small business owner, as well as an Affordable Care Act Marketplace enrollee. And together, they are going to help us understand both the policies as well as the lived experiences behind the current debate around affordable health care. And so I'll start things off as they relate to the enhanced premium tax credits. We heard Senator Shaheen bring them up in her remarks. And so just a little bit of background. In 2021, Congress expanded the ACA's expanded the premium tax credits that helped to improve affordability. It lowered premiums, it made coverage more affordable, and that helped drive record enrollment on the marketplaces for 5 years in a row. And so, Krissa, I'd like to start with you. As a marketplace enrollee, can you talk to our audience about what difference did these enhanced tax credits make for you as well as for your family? Oh, Krissa, I think you might be muted. Want to make sure we were able to hear you.
Thank you, Natasha. Thank you for having me, and thanks to Senator Shaheen for her insightful remarks. If you don't mind, I'll tell a little bit about my story going back to 35 years ago. About this time, my husband and I moved from Chicago up to rural northern Wisconsin to purchase an existing optometry practice and care for the visual needs of our community. We had a lot to learn, mostly about running a business. And our family, as well as our business, was growing. We added 3 daughters to our team. When we got there, it was just the 2 of us and 1 son, and then we added 3 daughters to make a family of 6. So we, were learning about what it was to have a small business, really. And one thing we knew for sure was we needed health insurance with a family of 6. Unfortunately, when we'd go and try to secure a plan that would cover our small business with ourselves and 3 to 4 employees and their families, we were always told every time we seeked it out over the 35 years that it would be better if each of us just went out individually, because there simply were no affordable plans for small businesses. It would make a lot more sense to just pay the employees enough to go out on their own, because it would cost so much more to be a group. So, we were able to insure ourselves because fortunately our business was successful enough, and we would try to pay our employees, high enough wages. We had a bonus system in place. But let's face it, if you're not making a really extra comfortable wage, let's just say, the thought of spending, hundreds or even over $1,000 a month for your family's premium only to have a very high deductible policy was not very attractive to a lot of middle wage earners. So we went along for years with our costs going up for our family. Just for a quick overview, in 2000 we were paying $650. In 2005, $1,050, and these were our monthly premiums for a high deductible policy. In 2010, $1,400, and then we did go down to a 2-person family in 5 years from that, which kind of leveled it at about $1,400. But then in 2000, shortly before the change you were talking about with the affordable care or the healthcare tax credits in 2020, we were paying $1,979. So let's just say $2,000 a month for a policy where each of the 2 of us, it was just 2 of us covered, and we each had a $6,000 deductible. Then came the Affordable Care Act, and ever since then, we've just paid between $200 and $500, depending, and receive per month. And for this, basically the policy that covers, with the same exact coverage and the same high deductible. This helped us so much, freed up, a lot of resources actually to pay our employees a little bit more. And then they were of a lower income bracket. So virtually they really didn't have a monthly premium. So of course they took the plan on, even though there was a high deductible, because you could always cover that $6,000 if things went from bad to worse, health-wise, it's, in your family, those deductibles could be handled as they came around, as long as you had at least had some coverage to protect you from basically bankruptcy and major medical disaster, So that was just a huge boon for us and helped out our family as well as our employees. And I just think it's exemplary of so many people in rural communities. We don't have a lot of big employers up here that have a big established or big quality healthcare plans for their employees. And we have a lot of small businesses, a lot of people that work for themselves as loggers, tradesmen, farmers, of course, daycare providers, other care workers, and people who work for any small business like mine in any field. So I'm happy to be here to speak for all those members of my community and try to also encourage, our Congress and senators to keep these tax care credits in place so that these millions of families that were finally able to have health insurance and not have the fear of what could happen without it, try to help us to keep that care coverage in place. Thank you.
Yes. Thank you, Krista, for sharing your own family's experience and also highlighting the impact that they had on not just you as an individual or as a family, but also that impact on broader communities. So whether that be the small business community or, as you mentioned, the rural community. But as was mentioned earlier, in the legislation, the enhanced premium tax credits are slated to expire at the end of this year. And already this year, Republicans have voted against extending them. They downvoted an amendment during the Big Beautiful Bill Act process that would have extended them. And so, Andrea, I'd like to turn it over to you to speak a little bit more about timeline. We heard Senator Shaheen say, the time is now for Congress to deal with this issue. It's not waiting for, another opportunity. So can you speak to, what is going to happen to families if this process is not dealt with ahead of the start of open enrollment on November 1st?
Yes, thank you, Natasha. We're really staring down the barrel of the absolute last moment. These tax credits can be extended and still go into effect in a way that'll help people when they're looking to enroll in coverage for next year. As you said, open enrollment starts November 1st. And if these tax credits aren't extended within the next few days, people will experience absolute sticker shock when they sign on to their marketplace or healthcare.gov and look at what their premiums look like for next year. On average, people will see their portion of premiums double, nearly double. The Congressional Budget Office estimates that around 4 million people will decide to forego coverage altogether because the premiums will be completely unaffordable.
Yeah, so those are, significant impacts and ramifications. And so it does not surprise me that healthcare is truly the sticking point in the looming shutdown debate. And so, Krista, I'll turn it back over to you. What goes through your mind when you hear that Democratic lawmakers are willing to negotiate with Republicans to protect Americans' access to affordable healthcare?
Well, I guess it makes me think that that's perfectly reasonable, for them. And I know whenever we've been in the majority, we've had to give up things, to bring Republicans to be able to get some votes from the Republican side at budget times like this. So it seems perfectly reasonable to me for the Republicans to sit down and maybe hear more about this. I mean, I was just on a call with my Senator Ron Johnson, and he was saying that so many of these tax credit type policies, like I can't remember what name he referred to for it exactly, but were just ill-gotten. He was basically describing that health insurance companies who, I mean, they want us to keep working with the health insurance companies, right? And here he is maligning them, saying that they're going out and adding people to the rolls so that they can get government money without even the people's permission, maybe, like they just find out their information and get them on the rolls. That is how he's trying to portray the plan that they're trying to cut. He's acting like it's some malevolent, plan with not real people on it. And of course, those of us who've been on it would just scratch our heads because, we get tax forms in the mail saying how much subsidy we've gotten. And we know we have these plans. Like, why would, let's say a plan is, even if it is free, for the person, they're going to know they have it if they've gotten signed up for it. It was just insane. It doesn't seem like he recognizes any of the positive things and the necessity to millions of families that these plans are. He's just focused on probably false information that, that there's been some misuse, which even if there has, then go after the misuse. Don't go after the millions and millions of families that are relying on this for their health care. So
Yes, great point, Krista.
Yeah.
There has been, a lot of myths that have been floating around as it relates to the enhanced tax credits. I've seen talking points around, oh, well, they're only being used for supposed illegal immigrants. And so there's a lot of myth busting that needs to be done to reiterate the fact that there are millions of American families who are benefiting from this improved financial assistance. And so a quick follow-up question, if you could speak directly to Republican lawmakers, what's the one thing that you would want them to understand about families like yours and the impact that the tax credits have had?
Yeah, just to kind of summarize, I mean, for years, middle income earners had no subsidies. If we did not have employer covered insurance or employer subsidized insurance, or have a low enough income to qualify for Medicaid, we were just subject to whatever the health insurance companies wanted to charge us. And, you have no choice. Either you need health insurance, especially if you're starting to develop assets like me, I'm retired now. If I decide to go without health insurance when it becomes too affordable with these cuts, I'm leaving all of my assets, subject to just losing my whole retirement fund based on one terrible health diagnosis. I mean, the coverage is so important for the health and also the wealth of all these working families that don't happen to work for a big company that has a health insurance plan. For years, people went without. We saw disastrous results of people not being able to afford their insulin and dying. I know people that had that happen too. People that put off going to the doctor, and by the time they go, it's kind of too late, and their outcomes are not that good. Yeah, I mean, this stuff is real, and the health impact as well as the financial impact that it has for all middle income earners across our country. So I would just ask them to think about this issue and others that really impact, the lives of families here on the ground. And maybe we don't need a fancy ballroom or a jetliner or big old military parades going down our streets, and we could channel the money into the things that are really needed by American families.
Well said, Krista. Andrea, I'll turn it over to you because we're both inside the Beltway. We know a lot of the attempts at blame that are going to there's going to be a lot of finger pointing, I think, in the coming days. But how do you think the public should understand who's responsible for their premium spikes in the coming weeks or just the increase in their overall healthcare costs?
Well, I think for folks who are paying as close of attention as we are, Krista included, it'll be pretty clear that Republicans should bear the blame. Democrats have come to the table and said we are just focused on trying to protect healthcare, access to healthcare, affordable healthcare for the American people, and meet us in the middle. And that's what we're trying to do here, or what Democratic lawmakers are trying to do here. Republicans argue that these tax credits cost too much. To build on Chris's point, the vast majority of Americans get their insurance through their employer, and they get to have that insurance with pre-tax dollars. There's an enormous tax benefit to getting health insurance through your employer, and that tax benefit is greater the more money you make. With premium tax credits, Congress, when they originally passed these, tried to give people who don't get health insurance through their employer a little bit of some fairness in the tax code, that they're working people who are paying taxes but had no benefit toward their health insurance until premium tax credits were made available. And the beauty of them is that they actually get less generous the more money you make, which makes sense. And Republicans had an absolute opportunity to extend these tax credits for middle income earners in the partisan tax legislation they passed this summer. They refused to do it. They're refusing to do it now. And Democrats have asked them to do it. Obviously, Democrats aren't in power and their leverage is very limited, but they're doing everything they can to make sure that people have access to affordable coverage despite not being holding any lever of power in DC at the moment.
Thanks, Andrea. So I want to shift gears a little bit. I think the shutdown is at the forefront of so many of our minds, and it shows us really what's at stake in the shorter term. But the big, beautiful bill, it laid out what felt like a longer term Republican vision for healthcare and included, historic cuts to Medicaid. And so I'd like to turn to a bit to what that would mean for individuals and families, as well as just kind of the broader healthcare community. So, Andrea, what are the ripple effects of the big, beautiful bill on providers and insurers?
Well, we're tracking this pretty closely at Protect Our Care. We have a hospital crisis watch. So when the big, ugly bill was originally passed, Congress Republicans were warned that hospitals would close their doors, especially in rural areas. And hospital service lines would have to be shut down because not all hospitals would be able to weather the effects of losing Medicaid covered services. So with fewer people, being able to pay for their care through Medicaid, hospitals will have to provide more uncompensated care, and they're readjusting their budgets just as households are readjusting theirs. So 330 hospitals are at risk of closure, and we're tracking that they're well on their way to meeting that number. Every day, it feels like every day you see another headline about a hospital closing or a service line closing in places like Alaska, Georgia, Michigan, New York, California, Ohio. It's happening all across the country, and it's accelerating because of the enormous $1 trillion in Medicaid cuts.
Thanks, Andrea. And Krista, you mentioned it a bit before, but, recognizing that you live in a more rural area. But can you speak more to what it would mean for your community if, your local hospital or a healthcare provider institution had to close because of a loss of Medicaid funding?
I'm not an expert in the whole system up here, but I do know that our largest provider in this whole region is really struggling financially, and they had to get some bailouts a little bit, and they finally did partner with another healthcare organization which will hopefully help out that situation. But it's kind of feels like we've been on the brink of losing our one hospital in the whole county. And like myself, our optometry office was the only optometry office in our whole county. And, I'm trying to recruit somebody to come here now because we had to close our business. That's another story. And it's really hard because everybody who would look into this area would see that a large portion, at least half of my customers were covered either by Medicaid or they had Medicaid as their Medicare supplement, because we have a high population of elderly people here in Rusk County. And so with cuts to Medicaid, that would probably make somebody kind of nervous about their clients, whether or not they would have coverage. And of course, whether or not that coverage would ever increase reimbursements, which is definitely an issue in rural areas, with low reimbursements from some of those programs when we have so many of our patients relying on them. But further cuts would only exacerbate that, I'm sure. Yeah.
Thank you, Krista. Oh, yeah. Andrea, you wanted to add something?
This is touching on an enormously important point, which is that hospitals are often the economic engines of communities, especially in rural areas. And if hospitals close or important service lines like maternity care close, it can be devastating for a community. It's really hard to attract new employers and young families to a place without hospitals or maternity care. So, beyond just hearing that a hospital is closing as a head, like there's a whole community behind that could really suffer.
Yes, excellent point. The fact that, these cuts and these changes are not just undermining affordability as well as access to care, but it really does have broader economic impacts for both the individual as well as the larger community. So we've spoken a bit about, kind of legislative changes that Republicans have championed, of course, the battle around the enhanced premium tax credits. But I also wanted to speak very briefly before we open things up to Q&A on regulation, a regulatory approach that the administration has pursued. And so earlier this year, the administration rolled out new regulations that are impacting the ACA marketplace. And so experts warn that these changes are going to shrink enrollment as well as further drive up costs. So really exacerbating the affordability challenges that we've already discussed. And so, Andrea, can you speak a little bit to how these regulations are going to undermine the upcoming open enrollment season, particularly as families already are going to have to grapple with increased premium costs?
Absolutely. Well, first, I want to mention a regulation that allows insurers to increase the out-of-pocket costs that families pay. And these are families who have employer-sponsored health insurance. So this is, not just a conversation about ACA tax credits. Like the impact on healthcare affordability is very broad. It's Medicaid, it's people with employer-sponsored coverage, and it's absolutely people with marketplace coverage. But this summer, the administration finalized a rule that makes enrolling and staying enrolled in marketplace coverage more challenging. And their own analysis suggests that up to 2 million fewer people are going to have marketplace coverage because they're making it harder to enroll. So this is minimizing things that help people seamlessly stay in their coverage, like people with employer-sponsored coverage have. So auto enrollment, it's increasing premiums, and adding a lot of paperwork to staying enrolled in marketplace coverage, which is a real shame.
It absolutely is just another kind of assault on Americans' access to health coverage. And so, Krista, when you hear that these new rules could make it harder for you to shop for coverage or enroll in coverage come November 1st, what kind of worries you the most?
Well, I know in my case, my premiums are going to go way up over $1,000 just for myself alone. And if you have to spend $1,000 a month to just keep coverage, you're probably going to go back to not wanting to go to the doctor, because then you'll have to spend more money because you have a high deductible. And so I would just worry that a lot of people won't be able to shoulder the higher costs. They'll go without insurance. Our health outcomes, we already know that Americans' health outcomes are worse than, they're continually getting worse compared to other countries, sorry, compared to in other countries. And I just think it's going to be even worse for sure for people's health and for their finances. Yeah.
Yes. Well, I want to thank you both for all of the insight that you've shared thus far. I do want to go ahead and turn it over to audience question and answer. So again, if folks have questions, feel free to use the Q&A feature on Zoom. But the first question that I've received is, we've been here before, particularly with threats to coverage. And this is for Andrea. What lessons from past fights, such as, the protecting the ACA fight, can help guide us now in this process to preserve affordable health coverage?
Well, I think what we learned from successfully defending the Affordable Care Act from repeal in 2017 is that your voice matters. And so making your voice heard to your member of Congress and your elected representatives is essential. And I would also encourage people to not only call their senator and House of Representatives, a member of the House of Representatives, but also their locally elected officials and their governors who have lines of communication to their federal lawmakers. And then share your story. Tell others and tell your elected officials why healthcare matters to you and why affordable healthcare matters to you.
Excellent. Thanks, Andrea. And Krista, this one's for you. So as someone that is directly impacted by these policies, can you speak to what keeps you motivated to continue to share your voice, as Andrea mentioned, and advocate for change?
Well, throughout my career, I had such a good vantage point of the whole healthcare system, really, because we were providers, we got paid by insurance companies, so we got to see how that end of it worked. And then we also were out there, like all self-employed, or middle income earners that didn't have coverage, where we were out there trying to get coverage to cover our family. And we knew the challenges of that, for over 30 years. So I think it was just natural that I became really interested in the system and hoping, that maybe in my lifetime we could have a better healthcare system for our country. And personally, I would think that more of a Medicare for all system that wouldn't necessarily involve the health insurance companies might make more sense, or could involve them. I'm open to hybrids, of course. Anything. Of course, the ACA wasn't perfect, but it was better. So I tried to push for that, and we've been pushing kind of for all these 20 some years, kind of in incremental steps to try to get better quality, affordable healthcare for all citizens of our country. Yep. So I just will keep at it. It's, I don't know if I'll see it in my lifetime or not, but I'm going to keep trying.
Love your vision for a healthcare future for this country. Another question that we've received from the audience is, how do Republicans justify the impact of rising premiums, as well as the impact of tariffs on small business, as well as other key portions of their voter base who are equally as harmed? Andrea, do you want to take that one?
I think that's a really good question. And I think that's something that a lot of them are probably grappling with right now. I think I don't want to misrepresent this number, but it's about a quarter of farmers and ranchers depend on marketplace coverage for their affordable health care. And over half, or nearly half, of enrollees in marketplace coverage are small business owners. And a lot of times, they tend to be aligned with more conservative lawmakers. So it's really concerning to see Republican lawmakers sell their constituents short and not seem to have a lot of sympathy for their high healthcare costs.
Yeah, it certainly is. It's a bit confusing when you see that, a lot of Republican lawmakers, it's their districts that have benefited from things like the enhanced tax credits. I know Florida, for example, they saw such significant marketplace growth because of the improved affordability there. The next question actually is going to be for Krissa. So, healthcare fights in Washington can certainly feel endless and overwhelming, as you alluded to. But from your perspective, what's the most important thing for people in your community to know as we try to navigate the changes in the months ahead?
Most important thing to know. And he's kind of addressing the whole big beautiful bill, or more the healthcare aspect.
I would say the healthcare aspect, or even the premium changes that we're anticipating.
Sure. I got distracted by that last question because it made me think of something that I often think of. If you don't mind me backtracking a little first, and then I'll try to answer this one. But it seems our Republican representatives disrespect so many of their constituents. You mentioned the farmers, which is a great point. And like I was saying, these rural areas, it's not many of us work for big companies that have insurance. So they're really just respecting, the farmers, the loggers, anyone that has a little restaurant, a little retail shop, basically the majority of our employers in rural areas can't afford their small businesses. They can't afford to provide health insurance for their people. And yet we are the economy, we're the backbone of the community and the backbone and everything that's, of the economy. We're like driving the engine there, really in rural areas, small businesses. So I hope that they can wake up, and even from an economy and business standpoint, that the Republican legislators will wake up and see the value in this. And I guess I would just like everyone to see that when it comes to tax cuts, it's the regular people that need the support, need to keep the tax cuts. And once again, we're the heart of the community. We're driving the economy. So please don't forget about us and keep giving all the tax breaks, to the wealthiest people in our country and leaving us behind. And I would tell anybody listening to do whatever you can to get that message across to your representatives, to your neighbors. And when we think about voting in the coming months, make sure to look for candidates that will have you in mind more than they will the billionaires.
Great point, Krissa. So as we come to the close of the event, wanted to give you and Andrea an opportunity to provide any final remarks, words of wisdom before we go ahead and wrap things up. Andrea, did you want to start?
Absolutely. I want to underscore the urgency of extending these tax credits now and not waiting until the end of the year. As we talked about, people are going to start shopping for their marketplace coverage on November 1st. And if people see these sky-high premiums that are nearly double, they're going to turn away and leave coverage altogether. CBO estimates 1.5 million people will be uninsured if Congress delays in extending these tax cuts. So I think it's critically important that the lawmakers who support affordable health coverage are standing their ground and making clear to the American people that they're trying to protect their health coverage and make sure that people can have affordable care moving forward.
Thank you. Krissa, any final words from you?
I think I was able to cover just about all my thoughts, and just thankful for people like you working on this, and hoping everyone in the country will really get interested, get on board, and elevate this issue so that our Congress will decide to extend these tax credits and keep quality health insurance affordable for all Americans.
Well, again, thank you both so much for joining us. Thank you to Senator Shaheen for bringing opening remarks today. Overall, the message is clear. Republican policies are cutting coverage, driving up premiums, and forcing families to pay more for less. Please stay engaged, share what you've learned today, and keep pushing for policies that put families first. On behalf of the Center for American Progress Action Fund, thank you again for joining us and being a part of the conversation. Enjoy the rest of your day.